There are 4 factors that affect how well a gas can diffuse across a membrane. The first is surface area. So the larger the surface area that it's going across, the easier it is for that gas to diffuse. So for example, we've got the alveoli here made up of individual alveolus. There's around about 350 million of these individual things. And if I were to open them up, the surface area is about 60 to 70 square meters, around about half the size of a tennis court. So a huge surface area. Now you can see how this would help gases to go back and forth because there's more room. If you have a disease like emphysema from smoking cigarettes, it can damage the walls of these alveoli. And if you damage the walls of the alveoli, it makes it look like one giant alveolus. And that actually significantly reduces the surface area, making it harder for people with emphysema to exchange gas across their respiratory membrane. So surface area, big one. Partial pressure, this is important. We know that we've got oxygen in our alveoli and we've got oxygen in the blood. We also have carbon dioxide in our blood and carbon dioxide in the alveoli. So how do we get the oxygen to jump into the blood in that direction and the carbon dioxide to jump into the alveolus in that direction? Well, they need to go down their own pressure gradient, what we call the partial pressure. So the pressure of the oxygen in the alveolus is around about 104 millimeters of mercury compared to around about 40 millimeters of mercury in the bloodstream. The carbon dioxide is around about 46 millimeters of mercury in the bloodstream and 40 in the alveolus. So as you can see, they're going down their own concentration gradient, what we call their partial pressure. Solubility. How soluble are the gases? Now this is important because oxygen is quite soluble, but carbon dioxide is about 20 times more soluble than oxygen, meaning it's easier for the gas to just diffuse across. This is why the carbon dioxide difference here, 46 to 40, isn't as great as 104 to 40 because oxygen requires a greater downhill push than carbon dioxide because it's less soluble. And then finally, the thickness of the membrane it has to cross. So there's a respiratory membrane and then the capillary membrane, plus there's connective tissue in between. It's very, very thin. However, if you've got an inflammatory lung disease, maybe COVID, for example, or pneumonia, it can result in more fluid building up inside the alveoli, and that effectively thickens the membrane it needs to cross. Or if you've had a chronic respiratory condition that can lead to scarring of the connective tissue here, it can also make it thicker and more difficult for the gases to cross.